My name is Austin Yeargan. I'm an orthopedic surgeon and sports medicine expert and an expert in molecular immunobiologics. I just wanted to talk today to you about some emerging technology and discuss why it's not covered by insurance. So one such technology is the TeneX health device. They make a TX-1, 2, and bone. The difference in the 1 and 2 are the distance, and the bone is a little more aggressive, so you can take bone out when you want it to breed. It's got a cautery tip on the end. It's also got an outflow portal to keep the tip cool. The way that this works is it shoots an ultrasound signal into tissue that comes back as a wave. If there is normal water in the tissue, then the wave is normal. It won't activate the microtip, so no treatment is done. Once it gets into degenerative tissue, that activates the microtip, which moves at ultrasonic speeds, also has cautery and outflow to keep it nice and cool. Make sure you don't get burned. The device has been amazing since it was released about 10 years ago. And even though it was released so long ago, it's still not paid for by insurance companies, even though it's widely known, widely efficacious, and promoted by some of the biggest names in sports medicine and shoulder and elbow surgery, like Bernard Morey, who popularized the use of the device around the hand, foot, and elbow. So what's the big deal with this new technology? The big deal is when I used to have to do open procedures for patients who had medial epicondylitis or golfer's elbow, or lateral epicondylitis, which is tennis elbow, would go to the operating room, do the debridement, and then it would take them 6 months to recover. And most people just weren't happy with that, and I don't blame them. This device allows us to identify the pathology with ultrasound, which we hold just over the skin. We anesthetize the skin and subcutaneous tissue, go all the way down to the pathology, which we can localize perfectly with the ultrasound. Once the tip is into the pathology, we activate the foot pedal. If the tissue is degenerative, it automatically activates until the degenerative tissue is gone. Oftentimes we'll inject PRP to help healing if more than one tendon is involved or if there's an actual tear in the tendon. The same can be performed on the lateral side of the elbow, where tennis elbow occurs most frequently. One of the great things about this is that it protects normal tissue, like these nerves running down here, and won't cause any damage. So even if you're not an experienced surgeon like I am, you should be using this device. So there's more emerging technologies that are available. We have all this wonderful technology available at our fingertips since we've learned the signaling pathways in biology. Most of it's not covered by insurance. And again, the reason why is because they don't want to delay the time before you get your joint replacement, because that's just an extra cost for them. They already have calculated what it's going to cost them if you have your knee replaced over a certain period of time. They know the fiduciary responsibility for that, and they don't want any additional. And from a business standpoint, that makes sense to me. However, as a patient, I want the best thing that I can possibly have, and I want to cover as fast as I possibly can. I want to be an athlete the rest of my life. So if anyone has any questions about this or wants to look into this technology for any kind of tendonitis that you might have, or if you want to discuss emerging technologies for things like rotator cuff tears and knee or other joint arthritis, then I would love it if you would direct message me about it, or even set up an appointment to come down and talk to me. We can get as in-depth as you would like. And while you're waiting, don't forget to check out your AI and try to figure out what some of this means.